There is a reason why they say your health is your wealth. And today we'll be looking at health matters. And joining us live from Malawi is Maziko Hisbon Matemba, Executive Director of Health and Rights Education Program, with over 10 years of experience in health policy advocacy in key health systems, and has performed a number of national and international campaigns. Thank you so much for joining us, Maziko, on One Slot.
Thanks so much, Rita, for having me. Thank you so much, and all the listeners.
Thank you for joining us all the way from Malawi. And you know, I read your profile and it talks about so many things about health. I would have maybe ventured into health, but anyways, we stuck with journalism. So we want to get more perception about what we call cancer. And from what we have seen, cancer is a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020. Now, when you go online, the National Institute of Cancer refers to cancer as a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. Now, that's just what we're seeing in mere definition. As a health expert, what exactly is cancer and how does it actually affect the body?
Normally, in simpler terms, because we're talking to the listeners, people from different levels of understanding of health care, but also we need much of the health literacy among populations to understand about their bodies. In simpler terminology, I think cancer is a lifestyle disease, meaning that it's a lifestyle disease that if you overdo certain things, it can lead to cancer. If you do over smoking, over drinking, or your body, you are taking some food which you are taking it over to the expected levels because of lack of awareness, some of those things can lead to cancer. So cancer is taken as if you have overdo certain things without maybe regulating your body uptake of things. So in simpler terms, that's what cancer can do to an individual. We have seen people where maybe they're doing smoke, they do drink a lot, or they're taking too much medicine without regulations, and that also can lead into cancer because the tissues and the cells might start now behaving differently depending with the how your body operates. So yeah, cancer has been attributed to some of the lifestyle, or in simpler terms.
Lifestyle disease, you say. Now, Nazibo, if you're looking at this in 2022, there was an estimated 1.9 million new cancer cases diagnosed and 609,360 cancer deaths in United States. Now, for some people, it's going to be a funny question, but I wonder, how prevalent is cancer in Africa? I mean, when we saw COVID-19, a lot of people said, this is not Africa's disease, it's more of a white man's disease. So is cancer a common thread in Africa?
Yes, cancer is a growing threat in Africa. It's not a growing threat, it has been there, but because of our investment, our healthcare investment in Africa has been supported by development partners outside Africa. And in Africa setting, seeking care is a challenge. Most people don't seek care early to diagnose different conditions, not only cancer, but other conditions. But also we have prescribed conditions, which in Africa we normally say, for example, malaria, TB, HIV, and other conditions. So we don't do much of diagnosis, because if you go at community level and you do a thorough comprehensive diagnosis of conditions, you find that most of the community members, they have cancer, but maybe they don't know that they have the disease because it hasn't been a priority in terms of investment. So investment has also attributed to the increase of cancer at the moment. For example, in Malawi, the recent report, which we just received some few days ago when Community World Cancer Day, every year we're having 19,000 cancer patients in Malawi. And if you go to our facilities, treatment centers in our big hospitals, we found out there are so many cancer patients which they are seeing. And with the limited specialists in that area, we are still overwhelmed. And for example, even for Malawi, you found out that after all these years, it's now we're having a cancer center. And also maybe it's also the same situation in other African countries, that we have minimal cancer treatment centers in our facilities, but also even including specialists in that area. So I think African government, they have done much in terms of investment in health in general. That's why now we are struggling with this disease. It has been there, but I think the diagnosis has been a bit later.
And you talked about detection. I mean, how do you know you have cancer? You're just walking on the street. What exactly are the measures to detect that one has cancer?
Basically, I think I don't go into science more into detail because I think that's a science which can take a bit longer. But when somebody has identified that he has some discomfort, because sometimes, for example, prostate cancer, even breast cancer, you can have a tumor. For example, women have a tumor on their breast, and they just maybe tick it. They don't understand what is coming from. It's a tumor, and later when they go to facility, they said no. For example, now they are maybe realizing that when I have discomfort to a certain condition, I need to find out what it is. That's when they found maybe it's breast cancer. For example, colorectal cancer is one of the common growing conditions where people are surprised to say, "Oh, I had this cancer," when they didn't know much in the area. So we have this prostate cancer, we have breast cancer, we have all these cancers, which I think because of lack of awareness, but also not seeking care early. But also the other issue is the diagnosis. We don't have diagnostic facilities in our countries. This we have to be honest with. Our diagnostic facilities may be the only testing for HIV, other just testing for TB and malaria. But for someone maybe to be tested for cancer, I think we don't have much equipment in our different facilities, even at tertiary level. So it has been a challenge for people to know whether they have this disease or not. So I think I'm hoping with this cancer awareness, but also with the growing numbers of cancer patients, I think we'll be able to diagnose early because the goodness of cancer, if it's good, diagnosed early, I think it's treatable. But once you delay and you come late, and with our latest healthy behavior, then we have problems.
Now, looking at this awareness program, I mean, you're part of rights education program of cancer in Malawi, and you talk about awareness in African countries. Is it reserved for a particular gender? And what exactly is the common ratio between men and women cases for cancer?
For example, for women, because they seek medical care early, the advantages of women, because they go to facilities because of antenatal care, but also they have got other issues. Women are more, they're able to go to facility early than men. And men, we go to facilities a bit later because culturally also men are look to be strong and they cannot go, maybe get a disease and others. That's why you will find all this prostate cancer, colorectal cancer, and most of them the men. But for women, the advantage is because of going to facilities regularly to seek different conditions. But also, naturally, women are the ones who carry babies, children to facility. So they've got opportunity to seek care when they go to those facilities when they are not sure about what is happening in their bodies. So that is a disparity. So that's why we found that now we have seen the growing males to be more having cancer. It's not that the women they don't have it, but the women because of that advantage they can be able to diagnose and be able to be given that treatment as early as possible. But also, as I said, the biggest challenge is our diagnosis and awareness. We don't have health literacy, robust health literacy programs in our countries in Africa, because the health literacy helps you to diagnose a disease. For example, in Malawi, there's an initiative called Chipatala Chapafoni. Is a local language. Then they said a hospital in a phone, just put in English. That's where in specified districts, community members can call to a specialist, to a doctor on a call, on a free line, on a hotline, and be able to ask a lot of questions about their bodies. So this has also helped for people maybe to notice that maybe they have a certain condition which they were not aware of. But also, as you know, we have limited few specialists in our hospitals, people who are equipped with the skills and knowledge to diagnose disease, to treat diseases. Most of our community members, about 80%, most of African countries, 60, 70%, we found that most of them live in rural areas and they've been supported by community health workers. They have limited skills, maybe to diagnosing maybe diseases like cancer. So we are losing out, but also maybe we're increasing incidence of cancer because of access to skilled health workers who can be able to diagnose and be able to translate what that somebody is suffering from. So Africa is coupled with the those skills, I'm hoping with these discussions, and I like the one spot and your program that you are discussing very pertinent issues. And I'm hoping with the coming of African CDC, African Disease Control, those will be some of the conversation we need to have at the African Union, at all levels, at even at different levels. Because if the African CDC doesn't initiate some of these conversation in our countries, making sure that there's available of high-tech lab facilities at different levels, not only at tertiary level. Because at the moment, as you know, cancer is defined to be identified at tertiary level. Maybe you have limited into the secondary level. At primary healthcare level, it's almost in non-existence. So these are some of the things which I think as a countries we need to make sure that at the AU when they're discussing, yes, we have the community health workers, but we need to have relevant skills which can be able to diagnose cancer. I think that's when we can be able to see to it that we can prevent cancer from growing.
All right.
But also,
Now,
another
Maziko, sorry to
contribution.
butt in there. Sorry to butt there, but you raise very salient issues there. You talk about issues of awareness, limited healthcare workers. I'm going to talk about another problem there because you mentioned community and we're looking at the rural areas there. These are still problems going on. Is there a problem of stigmatization? I mean, it's one thing to know that you have cancer, but some people in some areas do not actually accept the concept of surgery. Are these still issues in rural areas in treating cancer? Is this still a problem for cancer in Africa?
Yes, indeed. Issues of stigma and discrimination is one of the cancer, I call it cancer in quotes, that in Africa we need to manage as well because of misinformation, but also the coming in of technology with little literacy on how to use the technology which we have. Because, for example, people can post so many pictures of people maybe in hospitals, maybe people with certain conditions, and some of those conditions maybe they also bring stigma and discrimination to the community members. Others may be shy away. Others maybe they also attribute cancer, for example, in our traditional setting. I'm hoping even in Nigeria, you find out maybe others maybe when they have some of these diseases which are not common, people attribute that to witchcraft. You see now that maybe you bewitch somebody or something happened in between, knowing that that is a disease. Maybe it was prolonged, or maybe someone didn't manage to go and seek care earlier and be able to be assisted. So there have been several of those issues in Africa, which also have to be managed, more especially on the stigma and discrimination. But also, as I said, we have in Africa, for example, many people who are prescribing medicines in maybe in shops, in tailor shops, which are not regulated. And some of those medicines, some of them, when they're overtaken and there's no proper prescription, that's where the African problems is. But also we have overzealous people who are selling certain products which contains some of these medical products. But because people they don't know, there's no proper regulation and also proper awareness on how they can take medical products. It also leads to some of these cancers. So Africa, as Africa CDC, I'm hoping moving on, they need to have a robust program working with governments and making sure that the regulated framework in our Africa setting is doing their work in terms of regulating the profession of medicines in our hospitals, in our different settings, but also the people who are prescribed those medicines, they'll be well qualified and be able to give the right medicines. Because in the end, some of them, where they're prolonged, are taken, they can also lead to some of the diseases, including cancer.
Still looking about the treatment in cancer, let's look at the issues of oncologists there. I mean, you mentioned awareness. It's one thing to have cancer, it's one thing to have the awareness, but are there people who can actually treat this cancer? Is this still a problem in Africa?
Yes, for example, to have oncologists, we have very few people who are trained in oncology, and treating cancer is very expensive. And most of the government they also shy away to invest in that, and they're waiting for partner to fund to support those. You find that if you can do analysis of how many oncologists we have in Africa, there are very few. But also in terms of treatment, equipment, and others, they don't have rigorous equipment, even the medicines to do that. Because most of the cancer conditions they are not supported by traditional donors. I call tradition because we know them, they have sponsored and supported HIV, TB, and malaria. But most of them to maybe to support diseases like cancer, there are very minimal players globally who are supporting African countries on that. That's why African government is better for them to invest in early detection of cancer, and also to have specialists who can be able to support some of the citizen at the earlier stage, other than maybe waiting for this to grow and be able to reach a stage where government cannot be able to treat those. For example, here in Malawi, we are in the process of constructing a new cancer center. It's a very expensive adventure. It requires a lot of resources, but also it requires a lot of trained oncologists who could be able to man those facilities and also to have equipment which can be able to support different patients who are having those. So those are some of the key African challenges. I'm hoping as we commemorate the World Cancer Day, these are some of the discussions, serious discussion we'll be discussing. What are we doing on human resource? What are we doing on training? What are we doing on equipment and availability of these facilities? But also, most importantly, what are we doing on awareness, raising awareness, health literacy to the public, so that they should be able to understand that cancer is real and cancer kills. And in Africa, if you don't take this in the next 50, 20 years, we might see a lot of people dying of the disease. Maybe previously we knew to say that it's a disease from the West, rich countries, but now we have seen that is a growing disease in Africa.
And looking at this growing disease in Africa, Maziko, looking at children, are they also a risk of cancer? I mean, we talk about adult, we talked about female, we talked about breast cancer, we talked about prostate cancer. Are children still at risk of this particular disease?
Yes, as I said, cancer is a disease of a lifestyle. Some unfortunate children that also got cancer. But as I said, that if it is diagnosed a bit earlier, it's a bit treatable. Maybe we may not see much in the children because they have got access to services because they're young and they go to antenatal. For example, about they go to antenatal, but also they go to facilities to get the vaccination, but also any other services. So maybe on children, they might be a bit better off if you need the accessing care a bit earlier, so that when they have maybe noticed any other condition among them, it can be treated a bit earlier. But we're not saying that children they don't have such cancer in Africa, but maybe the access could be one of those opportunities which they might have. But the older generation that are challenged because of already seeking care.
Earlier on, you talked about a cancer care center in Malawi. I wonder, has there been any help from international organizations, international partners, or has this strictly been a government effort to eradicate and treat cancer? What has been international and regional efforts towards the awareness and treatment of cancer?
In Malawi, I think cancer is largely government, and it was an initiative of government to have a cancer center. Of course, there are partners who are supporting government, but I think there are not as many as we would expect. I think in most of those is government using domestic resources. That's why maybe you have seen that it's taking a bit longer to be completed. Because I think in most of the bigger partners, they're not. It's not their line of investment in Africa. But also, as you are aware, that cancer is very expensive. So maybe for most of the development partners and partners, maybe they look at the value for investment, whether that investment can be yield their expectations. Because as you know, partners, when they give this support, they also expect certain things to happen to their countries. So they're also trying to manage conditions which can spread in their different continent. So yeah, cancer being in non-communicable diseases, it has been disadvantaged because we have other non-communicable diseases like diabetes, hypertension, and others. If you look at them, support which come from partners, I think they're not as much you would expect maybe to other infectious diseases, which partners are ready available to support.
You mentioned diabetes, there's malaria, which is common in Africa. What's the level of priority of cancer in Africa? Do you think that has also been a problem in treating and making an awareness more open to people in Africa? What is the level of priority to this disease in Africa compared with all the diseases that we are also facing?
Yes, I think if you look at the parity in terms of the differences between awareness of cancer and other conditions, I think there's a very limited awareness. In fact, I have one of our oncologists. We work very closely on this, and he has been asking me to say, let's work together, more especially in raising cancer. And also, I have a relative who has a cancer, and I've learned a lot about the situation with cancer as a family member. So the levels of awareness, even when we are trying to do at family level, is also challenging. So I can see now even some of the things which maybe my leader could have avoided at the beginning. He was unable to find out whether it was cancer or not. It took a long time for him to find out where he was staying. So yes, I just want to agree with you that awareness should be one of the key in Africa about cancer. That when people have noticed or they are not comfortable to any condition which is happening to themselves, they need to go to a facility. But the question is, even if you go to facility, are they going to have supported? They're going to access to those services. You find out most of them, those services might not be available because at the current moment in Malawi, our cancer services are provided at tertiary, which is at central hospitals. But if you find that the district hospitals very rare, is very limited. So scaling up access to cancer services to a secondary level is one of the agenda which are maybe African CDC, the AU, and other bodies in Africa, regional bodies. They also need to start thinking through how do we make sure that we have cancer services accessible at all levels, more especially at tertiary, at secondary, but also even at primary level. Because if you don't have that at that level, we still have these problems, and sooner our hospital will be overwhelmed with some of this.
Now, finally, Maziko, what exactly are the dangers of cancer? I mean, if this is not treated, if there's no proper awareness of cancer in Africa, how badly can it affect Africa?
This can heavily bad Africa. Current moment, you have seen that most of the cash patients, because maybe of access, the people who are contributing positively to the development of our different countries in Africa. Most of the senior citizens, most of opinion leaders, most of our scientists in our countries, they're the one who are dying out of cancer. We have seen senior people in our society who are dying out of a disease, and this is killing the health workforce who can contribute positively to our economic development on our different countries. So cancer needs to be taken as seriously because it's a growing condition. It's a fifth killer disease in Africa. That has to be emphasized. But also at AU, when they're discussing health and other issues, cancer should be included as part of that. But also, as you know, this cannot happen without resources. Our domestic resources for health should be one of the key. It's good that the Africa Leaders Meeting, they agreed in Kigali in 2019 to increase money for health. If you look at our resources for health, at 15% in 2000, as you are aware, in Nigeria, in Abuja, where they came up with that at least 15% of the national budget has go to health. But look at African countries, they are less than 15%. In my country, we are about 9%. If you go to Nigeria, you find it's lesser than the percentage which you're supposed to be given on health, but also even our per capita. So if you have lesser resources for health, how you're going to achieve introducing cancer incidence in Africa when it's a very expensive adventure to treat cancer? But awareness will be key to make sure that there's awareness for cancer at different levels so that we should be able to avoid the spread of cancer, which is the fifth killer in Africa, as has been reported by our WHO in Africa.
All right, thank you so much, Maziko. A whole lot that needs to be done on awareness, prevention, and treatment of cancer in Africa, and of course, more budget resources for health sector in Africa. Thank you so much for joining us on One Slot. Thank you.
Thank you so much, Rita, for having me, and thank you so much, listeners. Thank you.
Thank you.